Okay, what I'm going to show you now is a sequence that I use with my patients for opening up the SI joint, the lumbar area, and the hips. So if you have sciatic problems or an SI joint instability, or if your lumbar vertebra have been smashed or disc is out of alignment, whatever's going on, you get chronic tension with corrective muscles, right? Muscles that try to re-stabilize you all the way through the hip, down the leg, up the back. And so this really opens up this section of your body, right? The whole thing. So the first thing you do is you're going to rotate on the femoral head. So it's a ball and socket joint. You're going to see your pelvis as it mounts on the top of the ball of the femur here. You're going to rotate around in an elliptical manner. It's not using your muscles. It's making loops, right? Circles as you pivot here. Not worrying about bending over your back or rotating, but focusing on the pivot here. And then rotate directions. And do this, at least once a day if you have recurrent problems with this. But run the sequence until you feel a balance, and you can switch directions and modify it. The second thing that you do in this sequence is you're going to clear out the channels on the kidney channel to get back to the earth, as well as open up and reestablish the connection between the SI joint through the movement, this line here to the greater trochanter, the head here. Anyway, what you'll do is you can use a chair to do this and stabilize one side, but if you can balance, then that's fine too. So, use a chair for this, or the wall, whatever you want to do. I think I need to do more distance. Anyway, you're going to strike the bottom of your foot, the kidney 1 point here, on the forward and backward swing of the leg, and then you're going to lift up and out while it's like your bones are a hanger and your muscle is the shirt. Or the clothing. You need to be soft and supple. About 60% of this is momentum. Maybe the last 35% is your muscles. So you want to make sure you're relaxed because you're trying to reset the cramping and pulling as you do this. That's why you don't muscle it through. So you strike the foot, hitting it forward and back. Practice this first, and then as you strike it, you're going to learn to lift it up and out, up and out, up and out, over and over. And you're really focusing on momentum here. You may not be able to see my foot hitting, that's okay. It's hitting the bottom of the ground on the forward and the backward stroke as it hits the ground right here, and here. You repeat that on the other side. So striking, back, forth, lifting up and out. This is important. You have to get to a point where you're not doing this, but you've got momentum and you start lifting from about right here. From this zone to this zone. So strike and lift. You have to use a little bit of muscle here as you engage it and open up. This is really good for the SI up to the greater trochanter, and it helps you realign the lumbar area. Once you've done that, you're going to go into, and I'm going to do this sitting so that you can really see it better. But you can do this on the floor. You'll be pretty far away for this. You can do this on the floor. It's called log stacking pose in yoga. But this, if you have an acute back sprain, this works and will fix it, but you have to commit to it. So, in any kind of stretch like this, you need to always lift up and out to elongate the lumbar area, right? You're worried about not compressing those bones and stretching it. So, I'm going to sit in this chair. Actually, let me correct this for you. Okay, I got a better angle. So what you're going to do is you're going to sit in any chair to do this. And you just sit near the edge so that you're open at the interior portion of your hips. And then you'll take your ankle, this outside, and put it over and behind the front of the knee. So here's the front of the knee. The distance is about this much between. And then when you do this is the easiest thing to do, and I do it at work. You can also I drop my foot usually inward too. Depends on how you're feeling. But you need to lift up first, open up, and then it's as if you're bringing your navel down first. You're not worried about your upper body. It's like it's going to reach straight forward and kiss your leg. And you want to focus on going forward and out. This right here can be done on the ground. Like I said, it's log stacking pose. You can sit with a bolster underneath you. You put one leg on top of the other. Just like I have here, it was as if the under leg, this is the upper the underleg was here, and they're completely on top of each other and parallel to your chest. This is just magnificent. It will, if you did this, if you have an acute back sprain, 10 minutes on each side per day will fix you immediately in the same day. But over several days, you'll keep yourself from having a problem. So you're focused on up and out, lifting, and bringing your belly button down, and then coming forward. And then you'll repeat that on the other side. Again, lifting up and out, belly button coming forward. And then that's it. That sequence right there is just wonderful. If you sit on the ground, sit on the ground. Most people have trouble with that. Great noise. Okay, thank you all.